So now we're going to take a look at Jennifer's face as far as how close she is to ideal proportions. So we use a caliper to measure certain distances on the face. So what I start with, and her eyes are closed, I'm just measuring the distance between her eyes. So this distance is a distance that your entire life will stay the same, and this is our reference distance. We're then going to look at where the point of greatest projection on her cheek should be. So I'm going to go from her inner eye and I'm going to swing around to about here. And this spot is what's telling me mathematically where we want to see most of her cheek projection. And she's already pretty much there, but that just confirms that that's the area that we want to see. Same thing we're going to do on the other side. We're going to swing it around to about here. So that marks out for me where I want to see the maximum amount of projection for her. We're going to be using 4 different types of filler, going from the firmest to the most flexible. And we're going to be using them in different areas where we want to achieve different results. So now we're going to start our filler treatment, and I'm going to start with our most firmest filler, which is our RHA 4, because that's going to give her the most lift in the areas that we want to see that. So I'm going to be using that to help lift her lateral cheek. And I'm going to start way out to the side here. Allie is using a vein finder so that we can try and avoid any vessels that we can see. Pain-wise, most patients will sense that first little pinch at the surface of the skin, but as we start injecting underneath the surface, it's more sensation of, I would say, pressure than anything else. So how do you feel about that, Jen?
It feels fine.
Okay. She's a very good patient. Okay. Now we're moving on to the next level of filler. It's a little bit softer, but still has a fair amount of firmness and projection. And you can see this gives her more of a sculpted look. So I'm going to continue along the cheek with a little bit more projection of her mid-face. Again, she's already got a nice amount, so I don't want to do too much. Just a little tweak there. And the other area I like to treat is what we call the piriform, which is this triangle next to the nose. And we want to bring that forward a little bit. We don't want to completely obliterate the nasolabial fold because you should have some degree of definition between your cheek and the mid-face, but treating in the piriform does help lift a little bit of the lip. You can see that effect when I push that in, that it does actually lift and turn out the lip a bit. So that's a nice kind of way of giving her a little bit of a lip lift without overdoing her lip itself. So now we're going to be treating her temples, and I'm going to be using a cannula. So a cannula is a long, thin tube with a opening on the end. It is not sharp. So it allows me to treat kind of a larger area smoothly. It's an advanced technique. And it's very nice for an area like the temple where we want to keep it nice and smooth. Now we're going to start treating just a little bit to Jen's upper lip. Her lower lip already has enough definition. So we're going to go in and do a little bit of bringing her upper lip kind of in the same line. So you see what we did here, gave you more definition here. You see the temples is very subtle, right? Mm-hmm. But it just actually gives you lift. I gave you a little bit more definition of your upper lip and a touch, just shaping of the lower lip, not more volume. Mm-hmm. A little bit more projection in the mid-face. Again, this is with swelling. In 2 weeks from now, this will all settle in like really.
And I think this is going to help where I was complaining about my under eye. I think
it's supporting better without going in there. Mm-hmm. I don't love treating this area because what happens is you can look perfect in my chair, and then a month later, the product absorbs water and you end up with like water bags under there. So I do everything possible to not have to put filler in that area.
Yeah.
And I think it came out really nicely.
Yeah, I think so too.
So thank you so much for attending. I hope that this was helpful, and I hope that you had fun watching what actually happens when we're treating a patient. Want to remind you all to ask your questions. We're happy to answer them live. In addition, you will get a text after the